Chapter 18, Nutrition During the Adult Years, Screencast 2. Now, what we're going to focus on this particular screencast are what are the nutrient needs specifically during the adulthood years. Now, one thing that I want to kind of point out here is we really aren't going to be covering anything new at this point in time. Really, what we're looking at, what are the principles that we've talked about the entire semester, about all of the various nutrients, minerals, vitamins, and so on, and how do we apply them to ourselves and people we know or people we're working with so that they're doing the best they can nutrition-wise so that they age gracefully. Now, a healthy diet can help maintain the body, preserve its function, and we already know that it plays a major role in avoiding and preventing chronic diseases such as heart disease, diabetes, and so on. Now, as I noted before, really what we're going to be enforcing now, or just applying, are those things that we've covered. You want to consume a variety of nutrient-dense foods and beverages. Okay. You want to keep diet low in saturated and trans fats, cholesterol, added sugar, salt, and alcohol. And then you want to maintain your body weight in a healthy range. So this really is just applying all of the things that we've talked about the entire semester. Now, if we're looking at some important things about what meeting nutrients needs does, it's going to delay the onset of certain diseases. It's going to help improve the management of existing diseases. A really good example is type 2 diabetes, weight loss, physical activity. They are all known to decrease and minimize the need for medications to manage diabetes. Speedy recovery from illnesses, also looking at an increase in mental, physical, and social well-being, and also decreasing the need for and length of hospitalizations. Now, what we do know so far, and this isn't a surprise because we've addressed this along the way, the American adult is ingesting too much fat, too many calories, too much sodium, and too much alcohol. Now, we are not getting enough of vitamin D and E, folate, magnesium, calcium, zinc, fiber, and women before menopause are not getting enough iron. Now, people at the age 65 and up, they're the largest at-risk group for malnutrition, especially those in long-term care facilities and hospitals. What we have next is a checklist to help identify those that are at nutritional risk before health actually starts to deteriorate. So here's that nutrition test for older adults, and it's based on a number of real simple questions related to nutritional status, patterns, and things like that. So let's take a look at what we're looking for. So if the person has a chronic illness or current condition that has changed the kind or amount of food eaten, the person eats fewer than 2 full meals per day, the person eats raw fruits, vegetables, or few raw fruits, vegetables, or milk products, the person drinks 3 or more servings of beer, liquor, or wine almost every day. The person has tooth or mouth problems that make it difficult to eat. The person does not have enough money for food. We know that many of our seniors are living on limited incomes. So this can be a really important factor here. The person eats alone most of the time, something else that we might see very common in seniors. The person takes 3 or more different prescription or over-the-counter drugs each day. The person has unintentionally lost or gained 10 pounds within the last 6 months. And the person cannot always shop, cook, or feed himself or herself. Now, we may take these things for granted. We're young, we have families, we have good social lives, all of those things are going on. But as we get older, we might not have all of these things. So that's where this nutrition test is actually coming into play to actually identify those seniors that are at risk for nutritional deficiencies and diseases associated with them. This is just a score, ideally 0 to 2, that's good, and recheck in a few months. 3 to 5 is considered to be marginal, And then once again, they might want to be looking at some local agencies to get information on nutrition and aging and those types of things. 6 or more, that is someone who is at especially high risk, and they really need to seek professional help, a doctor or registered dietitian, to kind of review and give them ideas on how they can improve their nutritional health. Now, the next few slides are going to be focusing on defining nutrient needs. We originally talked about DRIs, and remember those are divided into 4 age groups. And really what they're looking at is reflecting how nutrient needs change as adults get older. Now, calories is going to be the first thing that we look at. And as we already know, the typical American has excess energy intake. After 30, calorie needs steadily decline throughout adulthood. Now, this is due to a couple of reasons. The biggest one is going to be the decline in basal metabolism as we get older. Now, something that can impact this significantly is physical activity. So if you have a lower metabolic rate, you can actually use activity to increase times of higher metabolism. Protein, one of the things that's recommended for the older individuals is a slightly higher than RDA intake. And that's important because as we get older, we are going to lose muscle and bone mass, and having additional protein may help prevent this or slow it down. Fat, this isn't going to be any different from almost any recommendation that we've seen. We should be decreasing amounts of fat in the diet, and that is to reduce the risk of obesity, cardiovascular disease, and certain cancers. Now, one area in particular that older adults definitely have an issue with is carbohydrates. They generally will fall short of the recommendations, and the emphasis here is to increase complex carbohydrates, fiber, and to decrease simple sugars. Now, water is going to be especially important for those older individuals. Many adults, they're in a constant state of dehydration and electrolyte imbalance. Now, one of the things that I've kind of talked about along the way this semester is if I had to pick up one behavior that we are a lot better at than we were maybe 10, 12, 15 years ago, I would have to say we are a lot better about drinking water on a regular basis, focusing on hydration, and really kind of staying away from soft drinks, sugary drinks, and so on. Now, one of the things that may be an issue will be a fading sensitivity to the sensation of thirst, chronic diseases, and reduction in intake to reduce frequent urination. Medication, ostomy, or age-related decline in kidney function may also increase water output. Minerals and vitamins, specifically calcium and vitamin D, tend to be low in adult diets. Also, as we get older, we don't have as good an ability to absorb or synthesize vitamin D. Iron deficiency anemia is one of the more common types of malnutrition during the adult years. This could be due to a couple of things. There may be some damage to the digestive tract, injuries, and the use of medications may potentially impact iron levels. Zinc and magnesium, they are also low in adult diets, and the absorption of them is actually limited. Folate and vitamins B6 and B12. Now, we already have talked about folate previously, especially how important folate is for women of childbearing years. And remember, we are actually talking about pre-pregnancy folate levels as being a good marker. All of these are necessary to clear homocysteine from blood. We know that higher levels of homocysteine can be an indicator or risk for heart disease. Vitamin B12 absorption may be decreased due to decreased production of intrinsic factor. Vitamin E deficiencies may lead to a reduction in available antioxidants, and we've already addressed that free radicals and oxidative stress are things that potentially are related to the aging process, so you want to make sure that you're getting adequate antioxidants. Carotenoids may be something that will have protective health benefits. Lutein and zeaxanthin, those have been associated with lower risks of cancer and things of that nature. Now, the next series of slides is focusing on a number of things, and there's a couple of things that I'm going to point out here overall, because I think it is kind of important, and really how this is broken down is talking about what usual changes occur as we age, what are the nutritional implications of these changes, and how can we minimize the changes and promote successful aging. So that's really what we're looking at here. The first thing is changes in body composition. As we get older, we're going to lose bone mass. Age-related muscle mass is called sarcopenia, and there's no getting around that. We are all going to lose muscle mass as we get older. Specifically, we tend to lose the type 2 fast twitch fibers. For some reason, they're at a greater risk of decline as we age. We have greater amounts of fat and so on. Now, probably one of the big factors that we're going to be looking here that a loss of lean mass is, remember, muscle is metabolic tissue and accounts for a large part of lean mass. So if you're losing lean mass, that is going to result in an overall decline in metabolic rate. Also making sure that you're getting adequate fluid, that's going to be really important because once again, there's going to be a greater risk of dehydration, an inability to thermoregulate as well, and overall. Now, if we look at ways to minimize the changes and promote successful aging, having a nutritious diet that meets but does not exceed caloric needs, making sure that you're getting enough exercise. Now, we're going to include resistance training at this point in time because once again, we want to promote the building of muscle mass and maintaining and leaning that. And also remember the impact that that is going to have on metabolic rate. Now, eating high quality protein will also be important for the most part because that's something else that may potentially reduce the risk of age-related muscle mass. Now, I think you got the idea of the various systems that are going on. I spent a little bit time, probably longer, with body composition, and I'm not going to read these to you. You have these available. The table is in your textbook, and you should be able to identify what are some normal changes, the systems that occur, what are the nutritional implications associated with those changes, and what are some strategies? Here we're talking about skeleton, so it's going to be especially important in making sure that you're getting weight-bearing exercise, enough vitamin D, calcium, and so on to maintain bone health and so on. So that's just kind of an example of what you should be able to do, identify at least, one or two nutritional implications and be able to provide a strategy to counteract those changes. So cardiovascular and respiratory system, and you'll notice it's most of the systems here. The digestive system, the urinary system, nervous system, and the immune system. So all of those are going to be especially important, the endocrine system and the reproductive system. So together, you should be able to identify some changes that occur that are age-related, the nutritional implications, and then how can we minimize these changes and have a much more successful aging process.